Hey guys, and welcome to Animal Bites. In this video we're going to talk about animal bites and stings. Now, the main dangers that we should consider when it comes to animal bites or stings are, first of all, rabies, venom, and then it's bleeding and allergies. Now, we have already talked about allergies and about how to treat trauma injuries and bleeding. So in this video we're going to focus on rabies and venomous animals. Let's start. Okay, so let's start with rabies. And what is exactly rabies? Rabies is a viral disease that is affecting the nervous system of our body. Personally, I like to think about rabies like the zombie apocalypse virus. And yeah, you heard me correctly. I think there's a bunch of similarities, and you will soon see why. First of all, rabies gets transferred through the saliva, through spit. So it means that it is usually bites that will transfer this sort of disease. In some situations, scratches can also transfer the disease. However, it is less likely. The reason why scratches can transfer it is because some animals like to lick their paws. But generally, it is bites that we are worried about. Next, there is an incubation period. As I said, rabies mostly targets the nervous system. And the way it works is that it slowly climbs in the nervous system until it reaches the brain. Now, patients usually won't show any symptoms, or maybe very minor ones, until the virus reaches the brain. And once it reaches the brain, then our patient will show symptoms. However, it will already be too late, and we can't really save him when that happens. Now, the time it takes for the virus to reach the brain from the moment that our patient got bitten really depends on the distance. If our patient got bitten, for example, really close to the brain, then it will take a lot less time than if he got bitten really far away. However, the time it takes usually is somewhere between 1 to 3 months. Now, once rabies gets all the way to the brain, then what happens is that an inflammation starts there. This inflammation, it causes symptoms of a flu. We will have weakness, fever, headaches, all the signs that you guys know and already about the flu. I don't need to teach you this. However, after some time, this inflammation will start to affect brain activity. This inflammation will start to cause confusion, anxiety, hallucinations, even changes in behavior. So for example, our patient can become more aggressive, or maybe he will become more closed off and more quiet. Also, it can cause a loss of consciousness as well. And lastly, it will cause failure in the systems of our body, most notably the respiratory system. Our patient will not be able to breathe. Okay, so just as a recap, rabies is a virus that gets transferred through bites. It will take some time for the virus to affect us. However, once it does, it may change our behavior and it is not curable anymore. Can you see, guys, why I think rabies is basically the zombie virus?
Meow, brains! I want brains!
Luckily, unlike the zombie virus, rabies can be treated with a 100% effectiveness if it is recognized in time. The treatment for rabies is basically just a series of vaccinations that our patient need to go through to develop immunity to this disease. The downside of these vaccinations is, well, that they're not very fun, they're not very comfortable, and our patient will usually need at least 4 to 5 vaccinations to develop this immunity. So usually doctors give these vaccines only to patients who actually certainly need them. Okay, now let's talk about the treatment that we should do in case our patient gets bit by an animal. First thing we want to do is to wash the injury immediately with soap and water. Next, we would want to even sanitize the area with 70% alcohol. And then we want to bandage the area with a sterile gauze pad or a bandage. After that, if the animal that bit us is owned by someone, it is a home pet, then it would be a really good idea to approach the owner of the animal and ask him if the animal is vaccinated for rabies. If the animal is vaccinated for rabies, then well, we don't need to go for a clinic and we don't need to receive these vaccinations. However, if the animal is not vaccinated for rabies, or the owner is unsure, or we are unsure, then it is better for us to get tested. However, if the animal is a stray or it is a wild animal, then in that case, what we want to do is we want to identify which animal is it, how it looks like, and where is it located. We should do this without putting ourselves in danger. And the reason why we do this with rabies is because when we get to the clinic or to the hospital, we should tell that to the doctor so he can contact the city and they can make sure that that animal will not bite any other people around. And lastly, you want to go to a clinic immediately. If the clinic is closed, then you want to go to an emergency room. Keep in mind, it is usually very important for the animal that bit the person to also get captured and get examined. Now, we should never go and try to capture that animal ourselves unless it is our own pet. And even then, when we're trying to put our pet in a cage so we can take it to a veterinarian, we should really be careful that it will not continue to bite us more and more. Remember guys, safety comes first. And that is how we treat rabies. Now let's talk about venomous animals. If we're talking about venomous animals, then to be honest, it is very similar to rabies, where we also want to make sure that we wash the area with soap and with water immediately, that we sanitize it and we bandage it, as well as remembering the animal that did this. So let's go over the treatment one by one. The first thing we want to do is obviously to call for help. Next, we would want to calm down the patient. If our patient got bit by a venomous animal, whether it's a spider, a scorpion, or a snake, it is usually recommended that our patient will not move and that he will not be too nervous, because the rate of the heart and the movement in the body can increase blood flow and can increase the venom to spread. So we should calm down our patient, and we should also tell him to lay down on the floor. If the floor is completely flat, then just lay down flat on the floor. If it's a bit hilly, then make sure that the heart is above the area where our patient got the venom bite. And we want to make sure that he lays down and that he doesn't move. The next thing you'd want to do is you'd want to splint the area of the bite. So for example, if he got bitten in his arm, you want to make sure that you somehow improvise a splint so his arm will not move. Now, it is also very important that you will remember the animal that bit your patient. So if you can take a look at the animal, which animal is it? Is it the snake? Is it the spider? Is it a scorpion? Also, how does it look like? What is the shape of the animal? What is the color? It can be really helpful for doctors to know which antidote to give your patient. However, you would never want to delay the treatment just to find out which animal it is, okay? So if you already called the ambulance and you already washed the area from the venom, and you told your patient to relax, come down and lay down, then it would be a very good idea to try and find the animal without putting yourself at risk, to see which kind of animal is it. Also, if it is a really tiny scorpion or if it is a spider, then you can also capture it and take it with you to the hospital. You should only do this if you are confident that you can do this without getting stung, like get a sting, or bitten as well. But if you can do it and you're confident that you can do it, then yes, it would be a good idea to do so. And that is basically how we treat a venomous animal bite. Now, there are some don'ts that you guys should really remember, because I feel like there's so many misconceptions about this. So I like to call this the don't be Indiana Jones list. First thing that you should not do is don't put a tourniquet on your patient, okay? So if he got bit in his arm, don't try to stop the blood flow by putting a tourniquet and cutting the blood flow. It's fine. Let the blood continue to flow normally. Another thing that you should not do, obviously, is don't try to cut away the area to make sure that the blood will spill away and it will not, just don't cut the area of the injury. It makes no sense. Also, don't try to suck out the venom. This doesn't work, and it should not, you only poison yourself as well. You shouldn't even consider something like that. And lastly, this is actually not an Indiana Jones thing, but just don't put ice on the area of the bite. Okay, and that is it. I hope you guys enjoyed this video. I tried to make it fun, and I hope you enjoyed. I'll see you in the next one, guys. Bye-bye.